welcome. My name is Dr. Sean Lordan, and I am the host of the PTs PT podcast. And with me today, I've got a longtime friend, Dr. Eric Lagoy. And Eric is an accomplished doctor of physical therapy and a good friend. And he has a myriad of experience that he will go on and tell us about during this this interview today. But he's a professor at Quinnipiac University.
Yep.
And and I'd love for you to kind of go into detail. You're board certified in orthopedics.
Mm-hmm.
And really how I want to start, Eric, is just kind of introduce yourself, tell us a little bit about your career so far, and just give us a little background on your career and where you're at now.
Yeah, sure. Thanks for having me on, Sean. My name is Eric Lagoy. I am a doctor of physical therapy in Central Connecticut. I studied at the University of Connecticut for my undergrad degree, where I majored in exercise science and strength and conditioning. And at one point, I thought I wanted to be a strength and conditioning coach, but I did some internships in that realm. And that ultimately led me to pursue going back to graduate school to get my doctoral degree in PT. Been very sports medicine minded early on in my career, and I still consider myself to be, but I like to think I have much more diverse skill set to offer a variety of different patients at this point. So I treat full time for Gaylord Physical Therapy in Cheshire, Connecticut. I am adjunct faculty at Quinnipiac University, where I teach an exercise prescription elective for PT students. And I am the director of programming for Resilient Training Lab. I mostly handle remote programming services for that company. So that's my three different hats that I wear.
Yeah.
And they keep me busy.
Yeah, and, I don't know how you do that with, with the two kiddos too, with the two little girls. That's got to be really difficult. I can only imagine.
Yeah, there's some weeks that are a little bit harder, and some weeks where it's not too bad. So just kind of go with the flow, I guess. But I try to separate my work from my family time the best I can, because they grow up fast. So
Yeah. How old are they?
one is 6.5, and that is Aaliyah, and then my youngest is 3.5, and that is Demi, and she's the one that really is going to cause me to go gray. But everyone says she acts a lot like me, though, so I don't know.
And so
I
you're
guess
asking for it.
circle of life, yeah. So
Well, that's great. Yeah.
yeah.
So, maybe if we have a little time at the end, we can talk about, balance, right? And how you kind of tried to find some balance, at this point in your
For
career,
sure, that's something.
especially as a female dominated
Right.
profession, right? So, yeah, so that's great. So we got a little background. So I guess, could you tell, our audience a little bit about what kind of mentorship that you had when you came out of school?
Yep. So my first job coming out of school, I had a professor in school that really I connected with, and she really advised me to find a good mentorship program as a new grad. And that was one of the main things I was looking at when I was, looking at different job applications and opportunities. And some businesses had a formal mentorship program, which seemed appealing, but I ended up actually working for Gaylord initially. I left at one point and then came back, but I initially decided to work where I currently work at Gaylord, primarily because they had senior clinicians that I thought would be great to work under. They were kind of in the spot that I'm in now, where some others endeavors, and I thought that would be a really good opportunity for me fresh out of school to sit right next to an individual.
So
Okay.
perfect. So just jumping back into mentorship, we had a little technical difficulty there. Keep going there.
Yes. Right. So I was saying that fresh out of school, I wanted to make sure that I picked my first job somewhere where I would get really good mentorship. And I applied for a couple different positions. Some of them had formal mentorship programs, but I opted to work for Gaylord because even though they didn't have a formal mentorship program, I was really impressed with the staff there. A majority of them had board certified orthopedics, and some of them were adjunct faculty at local universities. So I thought that would be a really good spot for me to work as a new grad and be able to pick, the more senior clinicians' brains at times. So And I don't regret that at all. It was a really good first few years there with some of the clinicians I work with, and I still keep in touch with those individuals.
That's great. So would you say that finding an opportunity with, with a company that's got board certified therapists is kind of like, what a new grad you would suggest to a new grad?
For sure. I think it just shows that an individual that kind of pursues that realm to a degree, they're very career oriented. They're not just going to like settle in with just the doctoral degree of physical therapy. Not that there's anything wrong with that, but if I'm looking at a kind of a faculty page or a page about clinicians and I see a couple individuals with board certified orthopedics, I'm going to assume that that type of clinic really kind of cares about the level of care they provide, or at least the individual clinicians are electing to do that. It's not like you necessarily have to do that, so they're choosing to take on this responsibility of preparing for board certifications and then studying it and then obviously passing it too. So I do think it says a lot about an individual when they opt to do that.
Yeah, I think I couldn't agree more. Um, and I think that, there's a difference too between board certification and, manual skills, as well.
Right.
I think that, that's something might be able to talk about a little bit too. But yeah, I mean, I guess that kind of leads me to my next question. So sounds like you got a really good foundation, with your mentors and with, people around you that were board certified in orthopedics. Talk to me about, you're dry needling certified. Talk to me about, the Con Ed courses that you've taken and what you found helpful and maybe some courses that you found to be like, like I didn't really use that so much.
Yeah. Um, well, dry needling, way back when we had met in Atlanta many, many moons ago, the clinician that I worked under when I was on my affiliation was doing dry needling. And at that time, I feel like I'm kind of dating myself now, but at that time, it wasn't really something that was as popular as it was now. It wasn't even mentioned in school. So I was kind of like, where is this coming from? And I saw her use it. I saw some of the other clinicians use it, and that was my first exposure to it. And I decided at that point that at some point in my career, I wanted to pursue, getting dry needling certified. And it wasn't until a few years later that I ended up doing that. I took a couple courses from different companies too, which I actually liked, because most Con Ed courses will have like level 1, level 2, so on and so forth. And I took a couple level 1s because I wanted to see, how company A taught it, how company B taught it, how company C taught it, and kind of tease out a little bit of all the above, because they were all slightly different, which was interesting. Um, so, and that's a skill set that I leverage to this day, even though I took those courses years ago. It's probably not something I use with everybody. I think there's a time and a place for it, like anything that we can provide. But that would probably be one of the more valuable courses I've taken. At this point in my career, when I look at Con Ed courses, it's less about like kind of the new shiny toy. I think early on in my career, it was what can I go to on the weekend that I can immediately implement on Monday when I'm back in the clinic. And now I like to look for courses where I know I'm going to network with like-minded clinicians. I know, the social aspect's going to be very important to me. It doesn't necessarily have to be something where I learn a new skill set. I'm perfectly content spending a weekend like challenging myself to think about how I treat and practice, and if there's a way I can improve on that. So anything in that realm, I'm game for at this time. So
Yeah, it's interesting how that changes, huh?
right, yeah, and I remember I think I had one of my mentors told me that they're like, when you first graduate, you're going to want to take this course and that course and this course, and as you get further on, if you go to a weekend course, I specifically remember being told this early on. If you go to a course and you take away, one or two little gems from that weekend, when you're 10 years out, that's valuable. And so I think about that when I'm looking at courses. Is this something where I'll take away a couple things? Is this something where I'll meet some interesting people? I'll have conversations about, clinical practice. That's kind of the stuff that I look at now. It's not as like, that's why I said the shiny new toy thing. It's not as sexy as exciting sounding, but that impacts what I do, I think, more at this point than trying to learn a new manual skill or something like that. Because I've taken a lot of those sort of things.
Yeah, what other manual courses have you found to be helpful?
I took a course. I forget what company it was, to be honest, but I took a course to refine my skill set in cervical manipulations.
Mhm.
I don't know how they teach that in PT school these days, but I remember learning lumbar manipulations, I remember learning thoracic manipulations, I remember talking about cervical manipulations, but not actually. They kind of almost scared you into thinking you shouldn't be doing them. And then some of the senior clinicians that I worked with early on were well versed in that. So I saw them doing it and I picked their brain about, the safety of it, the efficacy of it, and then pursued a course where I'd spend a weekend practicing that skill set. So again, I could kind of add that to my repertoire. So that was probably one of the bigger manual ones. Before I was able to take a dry needling course, because initially you used to have like 1 or 2 years of clinical experience under your belt before you were even eligible to take a course like that. I don't know if that's still the case. So I wasn't even able to take dry needling course right as a new grad. And the company that I worked with wanted to have a couple clinicians that could use the Graston tool set. So I think I did that pretty early on in my career. Um, I kind of put a lot of those sort of things in sort of the manual therapy realms. A lot of my manual therapy skills came from those early mentors I had, though. They gave up many lunch breaks just trying to refine, how to crack this or move that sort of technique. So it's not like I have a certificate that I can show that I did this, but I've put in the work, over time with that sort of stuff.
Yeah, so I think there's a valuable gem of advice in there too, Eric, is, ask questions. So as a new grad, or if you're, even less than 5 years out of school, like just ask questions, at lunchtime,
Right.
to really kind of pick the brain of those around you, and even if they're
Yeah.
younger, they like
Right.
there are PTs that, that work for my company that, know different things that I don't know. And I'm always, eager to kind of learn, how they view the world with their different
Right.
clinical experiences and all that. So it's funny hearing you talk about, Graston, spinal manip, and dry needling, because I feel like we've taken a very similar path. And,
Yeah.
I wonder if that's just like our kind of generation of PT, like the mid 30s, like, graduated 10 years ago type
I,
scenario.
I would I would think so. Part of that for me was my background in exercise science and strength and conditioning. I think I overestimated my skill set in Therex prescription. I thought I had that in the bag. I knew I had way more coaching experiences than like a lot of the clinicians I was meeting on my clinicals. I felt comfortable programming and working in that realm. That's what I did in my undergrad degrees. So I really wanted in those early years to learn how to be a better manual therapist because I thought that would, you know, do well with my background already that I had in exercise science. But then it's not always transferable what we learn from a strength and conditioning and performance perspective. And when we're working with people in pain or people that have complex medical histories, it's not exactly the same sort of thing. So it would be interesting to talk to my younger self and see what sort of advice I would give, and if I'd even listen to my older self, I don't know.
Yeah, I mean, so
But
that
I think that was a big part of the reason why I picked the courses I did, because I thought I had the exercise side of things in the bag.
yeah, I mean, so it leads right into my next question is, what advice, knowing everything you know today, Eric, what advice would you give yourself when you
Yeah.
just graduated?
I think something you hear in any field from people that have been doing it for a long time is to just continue to kind of master the basics. And I think our field applies to that, so much. And when we talk about what the basics are, there's like a basic skill set for manual therapy. There's a basic skill set for exercise prescription and execution. And there's a basic skill set for communication. And those are probably the three domains where before you start to kind of overthink something, like really just make sure you're doing a really good job with the basics. Because even from the exercise prescription side of things, because I thought I knew the basics so well, I was kind of like, well, what other stuff is there that's, and I assume that complexity must have yield better results, but that's not necessarily the case when we really dig apart different options on interventions we can provide. Being really good at the basics is really hard. Because you have to kind of be patient and be willing to put in the work to do that, and just continue to refine those things when everybody else thinks they're going to move on to something else that's going to be the next end all be all. So I think I would tell myself that, like, don't think that you can check a box and then move on from that and then learn something else and check that box off and move on to the next thing. Like, you have to keep going back to those basics. And whenever I do have students that work with me, they'll ask questions like, how'd you get so good at talking to your patients? Like, how'd you get so good at coaching that movement? How'd you get so good at doing that? And it really does just kind of come with experience and practice, and just, trying to strive to get better and better at those basic qualities that we do on a day-to-day basis.
Yeah, and I think, so you mentioned the basics are, manual therapy, exercise prescription, and communication, right?
Yeah.
If you were to rank those three, Eric, how would you rank them in terms of importance to like a younger PT?
I probably would go communication first, exercise second, and manual therapy third. Actually, I would definitely, that would be the order. I'll lock it in. That's
Yeah,
my
I mean,
order.
I think I
Yeah.
do it. I think I personally would do like a triangle, and it would start with communication, and then exercise and manual be equal, to me. Um, and I think it's such a good point that you raise is like, the younger PTs trying to get fancy with the exercises, right? It's
Yeah.
like, hey, just, and I see it all the time, in students that I've taken and in clinical practice and, staff that we have. And, everybody wants to do something that's going to be newer and exciting and keep the
Right.
patient engaged. And, sometimes we forget that, bridges and clamshells still make people better. They did 20 years ago. They're still going to today, and
Right.
I think people are so fearful of becoming this cookie cutter PT that like, there are still some really good exercises that we've been doing for a while that, on an EMG recruit those muscles that we're trying to target,
Right. Yeah.
to reduce pain and create efficacious results, but no, I think that's such a good, it's such a wise point.
Right. And then if you're a new grad listening to this and you're hearing the communication thing, you're probably kind of rolling your eyes a little bit, right? Because it's a hard it's a hard thing to, because it's a soft skill, so it's not something you can like read a book about and just improve on. But I would say, like, when a student's been working with me for a little while, that's probably the number one question they'll have is, how do I improve the way I talk to somebody? Because like it just, they're doing the eval, they know they're kind of struggling a little bit to explain the results of this or whatever the case is, and they just want it to go smooth. They can, like, they just know that they're kind of coming off like a student, and it's a hard thing to like just say, well, if we practice this for 20 minutes you'll be a lot better at it. It's not really one of those things. You just got to kind of keep working at it, I guess.
Yeah, and I think, and I'll ask you like some more communication tips that you share, and I think, um, it's just so tough because everybody has different communication styles too, right? And so
Right.
how to match, you know, I think body language has a lot to do with it. And, if anybody's listening to this and they want specific techniques, um, is there one specific technique, Eric, that you've used in your career to help connect with people?
I would say the thing that I try to strive for is transparency and humility. So if I don't know, I will say I don't know, and I will say I'm sorry, I don't know. And a lot of people have never had a healthcare provider talk to them like that. And those are just the sort of conversations I'll have with patients, because I'm not batting 1,000 out there. Nobody is. I think that's something else as a new grad. You might be on social media looking at stuff, and you're thinking that some clinicians that have these big followings must get 100% of their people better. And I can guarantee you that's not the case. And if they have a higher success rate for me, then they probably just have patients that have more favorable prognosis than I do from the get-go.
Yeah.
But transparency and humility, because I'd rather tell someone I don't know than to give them an answer that to me feels like I'm just BSing just for the sake of appeasing them, because I know they're seeking for an answer. So that's probably the biggest thing. We do have literature and research in these areas as well, in terms of like what patients are seeking. There is less quantitative and more qualitative data. For example, we know when a patient comes to us for physical therapy, they want to know what their diagnosis is. They want to know what the prognosis is. So we can make sure, we know that from reading research on these sort of things, we can make sure we touch on those. So if I don't have a specific diagnosis to give somebody with 100% confidence, but I know that typically a person is looking for me to say something, I'm not just going to like not address what I think is going on. So I'll say something like, if I had to label this, I would call it tendonitis, just to kind of put that in perspective, because I know the person in front of me is looking for some sort of diagnosis for what's going on with them. So transparency and humility, and then it's not always the most exciting research to read, but you can find, research in this domain on communication specifically for therapy, but you can really find it for anything.
Yeah, and it's such a good point, and that's actually something that I learned in Georgia. And he was Dr. Duvall, and he loved Shirley Sauerman. He was definitely a disciple of Shirley Sauerman, and he was big on the movement diagnoses. And those can get really heady really quickly.
Right.
Anterior, disc, kind of like the TM, like anterior joint hypermobility or medial lower extremity hypermobility syndrome, and just like a really heady,
Right.
not even like tendinopathy or like stuff that we think ICD-10 terminology,
Right.
which
Right.
is really what people want, because they want something they can just go home and Google, and something that their PCP or
They
orthopedic.
probably have already Googled it. I'll say that to people too. You probably already Googled this.
Yeah, yeah.
And
What's
then
wrong with
I
my
take the
elbow?
words out of their mouth. I'm like, if you Googled what exercises to do, you probably saw these, like we know. We know if they probably Googled, I have low back pain. What do I do? Right.
Yeah.
So
Which is, and I think, Eric, it's better for our profession, because these people are already coming in like pseudo educated, and I think some
right.
PTs hate it. I love it, because it's like this person's actually here because they couldn't fix themselves on
Yeah.
their own.
Right.
And I think there's value, at least our demographic is like, they at least try it, and if they can't do it, then they're like, okay, I need to go see a professional.
Right.
But that's such a good point. Like people want to know generally what's going on with them, because they also want to know that it's nothing nefarious. And if it is nefarious, then we'll share that with them and be
Yep.
like, hey, listen, it's red. This is not looking. It's not what I
And
want
that
to see.
might be the diagnosis, like in the case of, sort of a tricky to accurately diagnose form of low back pain. I can tell you what it's not. I can tell you I don't see any signs of cancers. I can tell you I don't see any concerns about fractures. I can tell you I don't think you have a big disc herniation pressing on a nerve for these reasons. And sometimes that's just enough to go, okay, so then what do
Yeah,
we do now? Right. You just hear that like relief from them. So
because
sometimes
that's
it's
a
not
serious.
always,
Yeah, I
yeah,
mean, people get numbness and tingling. They refer symptoms down their arms or their legs. Like they think MS. They think,
right. They won't tell you
ALS.
exactly what they're thinking, So, yeah. So that's the sort of like type of communication I get, I guess. I almost try to stay ahead of what I think the patient's thinking, and, you know, answer their questions for them, even if they're not saying the question to me.
Yeah, and so yeah, I mean, for our listeners, that comes with experience,
It
and I
does.
think
Yeah.
and also you don't know, like I know I certainly wasn't prepared when I came out of school of all the diagnoses that come, in our field, and especially in sports medicine. I had no clue of probably 50% of them, and I learned my first 3 years was like that learning curve of like, oh,
Right.
this is what that presents like, and oh, that I saw that
Start
in
to
the
get the
textbook.
pattern recognition down. Right. Yeah.
Yeah, so I think that, give yourself some grace as a new grad, because it just takes time to see things. Um, but yeah, so what you're, an adjunct professor, and what do you enjoy most about teaching, Eric?
Well, it's nice to get out of the clinic every now and then, see some different walls and faces and stuff.
Yeah.
I'm blessed with my current role with teaching, because I pretty much, it's an elective, and the university I teach for, they spent a long time deciding who they wanted to teach this elective. And once they decided that I was the guy to do it, I had pretty much a blank slate to teach whatever I want. So I don't have to teach like necessarily to the core curriculum, or I'm not doing MMT or goniometry or anything along those lines. So I do like that I get to teach the stuff that is most important to me, because obviously when you're up there teaching in front of 25 or 30 people, and you've got other professors sitting in on your lectures, you can tell that I'm passionate about it. It's funny at this point. I probably have been teaching for 7 years or so, and I'm finally have like this rhythm, where I don't have to have like a bunch of words on the slide and read off the slides. I can just have a picture, and that picture will prompt me to talk about whatever I want to talk about. So I feel much more comfortable teaching, and that was one of the harder things when I started teaching, because when you're in PT school, you might have to do like a 20-minute presentation on something, maybe 30 minutes, right? Or an in-service when you're on clinical. And so you put your slides together or however you're doing it, and you might practice it a couple times, make sure you feel comfortable with it. Class I teach is 3 hours long, so I'm not going to practice a 3-hour lecture multiple times. So
Yeah.
you
No,
kind of put all this stuff together and you're going, geez, I hope this works. I don't know. And so the first few years I'd run over here or there. You'd be surprised how quickly you can fill up 3 hours. And sometimes I'd be under, not, so every time I would leave the university to go back to the clinic to treat, I would leave a voice memo on my phone on what I thought I could have did better, where I thought the students were sort of dozing off
yeah.
and where I kind of noticed them perking up and where what I wanted to add more of, what I thought was confusing. And I did that after every lecture I still do that. And then when it's time to teach my lecture again the next year, I pull up those voice memos, I listen to them, and that's how I update things. So it's finally gotten to a point where it's a pretty enjoyable experience for me. It's not as much work putting together new content. I'm just updating content to reflect either the feedback I'm getting from the students or changes in research or my own changes in how I, philosophize clinical practice. So
Yeah, that's awesome. I love the voice memo idea is great.
yeah, that was it, because I didn't have a lot of time to really sit down and reflect, but I'm like, I'm never going to remember how this, went once I go home and the kids are crazy and this and that. And then, months are going to go by and I'm going to want to update that lecture and it's going to be gone. So,
I mean, that's another little gem I think people can take from this, Eric, is, if you want to get better, you want to improve, reflect on what you did well and what you didn't do so well,
yeah,
either over the course of I think at the end of the day is probably the best case to do it, but it's tough to do that every day, but maybe at the end of the week, especially
right.
younger PT.
That's
So,
how I started for the OCS too, actually. At that time, I had like a 35-minute commute, and I would mostly listen to podcasts a lot, different podcasts like this one. And that was really helpful to try to somewhat be productive with my time. But then when I got to the OCS, it's a lot of memorizing, like flashcard style studying. And so I would just have all these flashcards. I would record myself saying one side, I'd pause, I'd record myself saying the other side, and I would just listen to them on the drive on my commutes. Not every time, obviously, because that would be awful. But I would try to make a goal, like an hour a week of like listening to me reading my flashcards, because I didn't want to get home and then have to do that. And I got a lot of hours studying for the OCS just on my commute, man.
so funny story. I did the same exact thing.
You're kidding me, dude.
So
That is wild.
I had a Toyota, I had a 2000, what is it, 2000 Toyota Solara, and the radio didn't work.
Yeah.
So I'd put the windows up and I'd put my phone in the cup holder and
Yep.
it would like reverberate the sound out. But what I would do is I'd record myself speaking in the chapters of the Orthopedic Secrets book. And I
Yeah. I know
like,
the book.
so there's something about like you hearing your own voice and it's like just the memory of it. And it's just like
Yeah.
me speaking the words. So I literally, every chapter in that book, I read
Dude, that's
verbatim. And it's just
insane,
like,
because I've told a lot of people that I've done that, and most of them just think I'm nuts for like
and
driving around listening to myself. And the
yeah,
problem was that I recorded it and I didn't really pause long enough. So I'd read one side of this flashcard and then I'd wait like 2 seconds thinking that was enough and read the other side. So I had to get really good at it to like beat myself.
yeah, to think quickly. That's so funny. Oh my goodness.
Yeah,
It's
that
a
is
good
funny.
strategy though. I think that's
I mean, I was driving half an hour each way. That's an hour a day. That's a good chunk of time. It's 5 hours a week that I'm just, like to be productive, I guess, with my time. So, obviously not all the time. Sometimes I just want to listen to music or listen to something not work related. So, but I would set a goal, like I'm in the car 5 hours. It's not that hard to get, 90 minutes of like something productive in weekly with that. And you do that for a month, you just knocked out 6 hours of studying.
I mean, it's huge. Yeah,
Yeah.
I think there we go. This podcast is full of gems, Eric. I think,
I
but
guess so.
so that leads me to my, so we got 5 minutes left or so. So I wanted to just dive into a couple questions for you personally.
Yep.
Favorite concert?
Favorite concert? I've seen quite a few concerts. Give me a second here. There's this band called Dirty Heads. They're kind of like Sublime genre. I'm probably dating myself again. It's a new
Yeah.
grad listening to this,
Yeah.
but I've seen them a few times. But the first time I saw them, I didn't know who they were. My wife and I went up to Vermont at this ski mountain in the summertime. That was right around the 4th of July, and they had a bunch of different bands playing there, and it was just a beautiful day. And that band played, and I just remember, having a lobster roll and a drink, and this band was playing, and it was just a really great feeling. And we told ourselves, whenever they come to Connecticut, we're just going to go. And we probably have seen them 3 or 4 times together since then, just me and her. So that has to be the first one, has to probably be my favorite concert.
That's awesome. That's awesome. Best meal you've ever had, and who did you share it with?
Best meal I ever had. Also with my wife for her 30th birthday. I knew that we were going to be expecting our second child. So I knew it wasn't going to be like this crazy 30th birthday, like she did for me. So, because I'm a couple years older than her. So she was about 5 or 6 months pregnant. So I booked a Broadway show in New York, and I wanted to go to a 1 or 2 Michelin star restaurant. I'd never done this before. One of those like six course meals where they bring each thing out to you, and it was just absolutely incredible experience. Because she was pregnant, the customer service side of things was like way over the top. I mean, she couldn't even, blink without someone coming over and asking her if everything was okay and pulling her chair out to go to the bathroom. And so it was a really kind of intimate experience, because at that point we already had one kid, so you don't get a lot of time like those sort of moments when you've got young children. And I just remember that the food was really good, and she was completely shocked. It was a complete surprise that I did that for her. But mostly the food. I'll
Yeah.
never forget how good some of the food was that I had there. And I cook a lot, so it completely changed how I view cooking and what food can actually be. It's remarkable when you have food at that level.
Remember the name of the restaurant?
I don't remember the name of the restaurant, but I remember the executive chef was Charlie Palmer. He owns several restaurants like around New York City and stuff like that.
That's cool.
So drawing a blank on the name, but if you search Charlie Palmer New York City restaurant in the Broadway area, it would pop up. It's still there.
Nice. Love that. What does it mean to be a great PT in one sentence or 2 sentences?
Let's see. So 2 sentences, great PT. I'm going to say that, what's that?
I said I'll give you a 3 sentence paragraph if you want.
I'll just start rambling if you give me too
Yeah,
much there. So I got to kind of dial it back a little
yeah.
bit. But I'll say being a great PT probably means, I remember when I was in school, they talk about the concept of being a lifelong learner. That was something else I probably sort of rolled my eyes at the time. But I do think if you are transparent and humble with people and adopt that lifelong learner mindset, you'll probably end up being a great PT, whatever version of that looks like for you. I don't think, all great PTs look exactly the same in terms of how they treat and do their things. But I think there's a certain kind of mindset that great PTs sort of have. They're continuing to try to learn. It's not like they, stop trying to be great just because they're 5, 10, 15 years out. So there are certainly some commonalities there. And I would say lifelong learner, being humble, and being, transparent are probably what make a great PT.
Yeah, that's great. Last thing before I let you go and say thanks, a mantra for Eric Lagoy. What's the mantra for your life? How do you live your life?
Right now, with everything I got going on, I just try to live it one day at a time, and I just try to be present in the moment with whatever I'm doing. So less screen time.
Yeah, I mean that's it. Yeah. Good luck with that.
I know, right?
Good luck with that. And my kids are currently probably my daughter. She winds down at night with the iPad or
I
whatever.
know they all do. But
It is
my
what
mantra at the moment is to just try to be present with whatever I'm doing. If I'm washing dishes, then I'm going to just wash the dishes.
you wash the hell out of those dishes.
Yeah. And if I'm at work, I'm going to be at work. And if I'm at home with the kids, I'm going to be at home with the kids.
Yeah.
I have to work to do that. But I think that's trying to be my current mantra.
Yeah.
And I've enjoyed that since I've, been working at it.
Yeah, I love that. I love that. Well, that's great advice. And Eric, thank you so much again for joining me today. Really appreciate your time, and it's great catching up.
Yeah, man, you got it. This was fun.